41. A patient with hemophilia B is prescribed factor IX. What is the nurse's priority assessment? A. Blood glucose levels. B. Signs of allergic reaction. C. Respiratory rate. D. Skin turgor. Answer: B. Signs of allergic reaction. Rationale: factor IX is a blood product and allergic reactions are a potential risk during administration. Monitoring for signs of allergic reaction, B, is the priority. Blood glucose, A, respiratory rate, C, and skin turgor, D, are not directly related to factor IX administration. 42. A nurse is caring for a patient with a hematocrit of 20%. Which symptom is most concerning? A. Tachycardia. B. Mild headache. C. Increased appetite. D. Dry skin. Answer: A. Tachycardia. Rationale: a hematocrit of 20% indicates severe anemia, causing tachycardia, A, as the heart compensates for reduced oxygen delivery. This is concerning and requires intervention. Mild headache, B, increased appetite, C, and dry skin, D, are less urgent and not specific to anemia. 43. A patient with thrombocytopenia is scheduled for surgery. What should the nurse ensure? A. Platelet transfusion is available. B. High-protein diet is provided. C. Warm compresses are applied. D. Ambulation is encouraged. Answer: A. Platelet transfusion is available. Rationale: thrombocytopenia increases bleeding risk during surgery, so ensuring platelet transfusion availability, A, is critical. A high-protein diet, B, is not specific to bleeding risk. Warm compresses, C, may worsen bleeding. Ambulation, D, does not address the surgical risk. 44. A nurse is reviewing a patient's lab results showing an APTT of 60 seconds. What medication is likely causing this? A. Aspirin. B. Heparin. C. Warfarin. D. Clopidogrel. Answer: B. Heparin. Rationale: a prolonged APTT, 60 seconds, indicates anticoagulation, most commonly caused by heparin, B, which is monitored by APTT. Aspirin, A, and clopidogrel, D, affect platelets, not APTT. Warfarin, C, prolongs PT/INR, not APTT. 45. A patient with sickle cell disease reports joint pain. What is the nurse's first action? A. Apply ice to the joints. B. Administer prescribed analgesics. C. Encourage active range of motion. D. Restrict fluid intake. Answer: B. Administer prescribed analgesics. Rationale: joint pain in sickle cell disease is often due to vaso-occlusion, requiring analgesics, B, as the first action to manage pain. Ice, A, may help but is secondary. Active range of motion, C, may worsen pain. Fluid restriction, D, is contraindicated as hydration is essential. 46. A patient with multiple myeloma is at risk for which electrolyte imbalance? A. Hypercalcemia. B. Hypokalemia. C. Hyponatremia. D. Hypomagnesemia. Answer: A. Hypercalcemia. Rationale: multiple myeloma causes bone destruction, releasing calcium into the blood, leading to hypercalcemia, A. Hypokalemia, B, hyponatremia, C, and hypomagnesemia, D, are not typically associated with this condition. 47. A nurse is caring for a patient with a history of pulmonary embolism. Which intervention prevents recurrence? A. Encourage prolonged bed rest. B. Administer anticoagulants as prescribed. C. Restrict dietary vitamin K. D. Apply warm compresses to legs. Answer: B. Administer anticoagulants as prescribed. Rationale: anticoagulants, B, prevent clot formation, reducing the risk of pulmonary embolism recurrence. Prolonged bed rest, A, increases stasis and clot risk. Vitamin K restriction, C, applies to warfarin, not all anticoagulants. Warm compresses, D, may increase circulation but are not preventive. 48. A patient with anemia is prescribed epoetin alpha. What should the nurse monitor? A. Blood pressure. B. Blood glucose. C. Respiratory rate. D. Urine output. Answer: A. Blood pressure. Rationale: epoetin alpha stimulates red blood cell production, potentially causing hypertension. Monitoring blood pressure, A, is critical. Blood glucose, B, respiratory rate, C, and urine output, D, are not directly affected by epoetin alpha. 49. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which lab result supports this diagnosis? A. Decreased fibrinogen. B. Increased hemoglobin. C. Normal platelet count. D. Decreased INR. Answer: A. Decreased fibrinogen. Rationale: DIC consumes clotting factors, leading to decreased fibrinogen, A, a hallmark of the condition. Increased hemoglobin, B, is not typical. Platelet count, C, is usually low in DIC. INR, D, is prolonged, not decreased in DIC. 50. A patient with chronic lymphocytic leukemia reports a fever. What is the nurse's first action? A. Administer antipyretics. B. Assess for infection. C. Encourage fluid restriction. D. Apply a cooling blanket. Answer: B. Assess for infection. Rationale: fever in chronic lymphocytic leukemia suggests infection due to impaired immunity. Assessing for infection, B, is the first action to identify the cause. Antipyretics, A, and cooling blankets, D, treat symptoms, but not the cause. Fluid restriction, C, is inappropriate as hydration is needed. 51. A patient with iron deficiency anemia is prescribed ferrous sulfate. When should the nurse advise taking it? A. With meals. B. At bedtime. C. With orange juice. D. With milk. Answer: C. With orange juice. Rationale: ferrous sulfate is best absorbed with vitamin C, such as in orange juice. C. Taking with meals, A, or milk. D. Reduces absorption due to food or calcium interference. Bedtime, B, is not optimal for absorption. 52. A nurse is caring for a patient with a prothrombin time, PT, of 18 seconds. Which medication is the patient likely taking? A. Heparin. B. Warfarin. C. Aspirin. D. Clopidogrel. Answer: B. Warfarin. Rationale: a prolonged PT, 18 seconds, indicates anticoagulation, typically caused by warfarin, B, which is monitored by PT/INR. Heparin, A, affects APTT. Aspirin, C, and clopidogrel, D, affect platelets, not PT. 53. A patient with hemophilia A falls and reports knee pain. What is the nurse's priority action? A. Apply a warm compress. B. Administer factor VIII. C. Encourage ambulation. D. Restrict ice application. Answer: B. Administer factor VIII. Rationale: knee pain after fall in hemophilia A suggests joint bleeding, requiring factor VIII, B, to stop bleeding. Warm compresses, A, worsen bleeding. Ambulation, C, may increase bleeding. Ice, D, is helpful but secondary to factor replacement. 54. A nurse is teaching a patient with sickle cell disease about self-care. Which instruction is most important? A. Avoid high altitudes. B. Increase dietary sodium. C. Limit physical activity to 1 hour daily. D. Use heating pads for pain. Answer: A. Avoid high altitudes. Rationale: high altitudes reduce oxygen availability, triggering sickle cell crises, so avoiding them, A, is critical. Sodium intake, B, is not directly related. Physical activity, C, should be balanced, not strictly limited. Heating pads, D, are contraindicated as they may worsen vaso-occlusion. 55. A patient with lymphoma reports night sweats and weight loss. What should the nurse document these as? A. Allergic reactions. B. Symptoms. C. Infection signs. D. Metabolic imbalances. Answer: B. Symptoms. Rationale: night sweats and weight loss in lymphoma are B symptoms, B, indicating systemic disease and guiding treatment. They are not allergic reactions, A, infection signs, C, or metabolic imbalances, D. 56. A nurse is administering fresh frozen plasma. What is the primary purpose of this transfusion? A. Increase red blood cell count. B. Replace clotting factors. C. Boost platelet production. D. Enhance immune response. Answer: B. Replace clotting factors. Rationale: fresh frozen plasma contains clotting factors and is used to replace them. B. In conditions like coagulopathy. It does not increase red blood cells. A. Boost platelets. C. Or enhance immunity. D. 57. A patient with thalassemia major reports fatigue. What should the nurse assess first? A. Hemoglobin level. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer: A. Hemoglobin level. Rationale: fatigue in thalassemia major is likely due to anemia, so assessing hemoglobin level, A, is the first step. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to fatigue in this condition. 58. A nurse is caring for a patient with a platelet count of 20,000/mm superscript 3. Which precaution is most important? A. Encourage vigorous oral hygiene. B. Use an electric razor for shaving. C. Allow unrestricted ambulation. D. Apply heat to bruised areas. Answer: B. Use an electric razor for shaving. Rationale: a platelet count of 20,000/mm superscript 3 indicates severe thrombocytopenia, increasing bleeding risk. Using an electric razor, B, prevents cuts and bleeding. Vigorous oral hygiene, A, may cause gum bleeding. Unrestricted ambulation, C, risks injury. Heat, D, worsens bruising. 59. A patient with pernicious anemia reports numbness in the extremities. What is the nurse's best action? A. Administer vitamin B12. B. Encourage ambulation. C. Apply warm compresses. D. Restrict dietary folate. Answer: A. Administer vitamin B12. Rationale: numbness in pernicious anemia results from vitamin B12 deficiency affecting nerve function. Administering vitamin B12, A, addresses the cause. Ambulation, B, does not treat neuropathy. Warm compresses, C, are ineffective. Folate restriction, D, is unnecessary and may worsen anemia. 60. A nurse is monitoring a patient receiving warfarin. Which dietary instruction is most important? A. Maintain consistent vitamin K intake. B. Avoid all carbohydrates. C. Increase calcium-rich foods. D. Limit protein intake. Answer: A. Maintain consistent vitamin K intake. Rationale: warfarin's anticoagulant effect is influenced by vitamin K, so maintaining consistent intake, A, ensures stable INR levels. Avoiding carbohydrates, B, increasing calcium, C, or limiting protein, D, is not relevant to warfarin therapy. 61. A patient with acute lymphoblastic leukemia is prescribed intrathecal chemotherapy. What is the nurse's priority action? A. Monitor for signs of infection. B. Ensure proper positioning during administration. C. Encourage oral fluid restriction. D. Apply ice to the injection site. Answer: B. Ensure proper positioning during administration. Rationale: intrathecal chemotherapy requires precise positioning, B, typically lying flat post-procedure, to ensure drug distribution and prevent complications like headache. Monitoring for infection, A, is important but not specific to administration. Fluid restriction, C, is inappropriate. Ice, D, is not indicated. 62. A nurse is caring for a patient with a hemoglobin of 8G/DL. Which activities should be avoided? A. Assisted ambulation. B. Vigorous exercise. C. Deep breathing exercises. D. Eating a balanced meal. Answer: B. Vigorous exercise. Rationale: a hemoglobin of 8G/DL indicates severe anemia, reducing oxygen delivery. Vigorous exercise, B, increases oxygen demand and should be avoided. Assisted ambulation, A, deep breathing, C, and eating, D, are safe and beneficial. 63. A patient with a history of deep vein thrombosis reports leg swelling. What is the nurse's first action? A. Elevate the leg. B. Apply a warm compress. C. Encourage ambulation. D. Restrict fluid intake. Answer: A. Elevate the leg. Rationale: leg swelling in DVT suggests venous obstruction. Elevating the leg, A, reduces swelling and promotes venous return. Warm compresses, B, may worsen swelling. Ambulation, C, risks dislodging a clot. Fluid restriction, D, is not indicated. 64. A nurse is teaching a patient with folate deficiency anemia. Which food should the nurse recommend? A. Broccoli. B. Milk. C. White rice. D. Bananas. Answer: A. Broccoli. Rationale: broccoli, A, is rich in folate, essential for treating folate deficiency anemia. Milk, B, white rice, C, and bananas, D, are low in folate and not effective for this condition. 65. A patient with polycythemia vera reports headache and dizziness. What is the nurse's priority action? A. Administer analgesics. B. Assess for dehydration. C. Encourage bed rest. D. Restrict dietary iron. Answer: B. Assess for dehydration. Rationale: headache and dizziness in polycythemia vera may result from hyperviscosity or dehydration. Assessing for dehydration, B, is the priority to guide treatment. Analgesics, A, treat symptoms, not the cause. Bed rest, C, is not specific. Iron restriction, D, is not relevant. 66. A nurse is caring for a patient receiving a blood transfusion. Which action prevents a transfusion reaction? A. Infuse rapidly within 1 hour. B. Verify patient identity and blood type. C. Use saline as a priming solution. D. Administer without checking vital signs. Answer: B. Verify patient identity and blood type. Rationale: verifying patient identity and blood type, B, prevents ABO incompatibility reactions. Rapid infusion, A, risks fluid overload. Saline, C, is standard but not the primary preventive action. Checking vital signs, D, is essential to detect reactions early. 67. A patient with aplastic anemia reports bruising. What is the nurse's priority intervention? A. Apply pressure to bruised areas. B. Encourage vigorous activity. C. Administer oral iron. D. Restrict dietary vitamin K. Answer: A. Apply pressure to bruised areas. Rationale: aplastic anemia causes thrombocytopenia, increasing bruising risk. Applying pressure, A, minimizes bleeding. Vigorous activity, B, increases bleeding risk. Iron, C, is not indicated for aplastic anemia. Vitamin K restriction, D, is irrelevant. 68. A nurse is assessing a patient with a suspected clotting disorder. Which history finding is most concerning? A. Frequent nosebleeds. B. Occasional headaches. C. Mild fatigue. D. Dry skin. Answer: A. Frequent nosebleeds. Rationale: frequent nosebleeds, A, suggest a clotting disorder such as thrombocytopenia or coagulopathy and require further investigation. Headaches, B, fatigue, C, and dry skin, D, are less specific to clotting disorders. 69. A patient with chronic myeloid leukemia is prescribed dasatinib. What should the nurse monitor? A. Blood pressure. B. Platelet count. C. Blood glucose. D. Respiratory rate. Answer: B. Platelet count. Rationale: dasatinib can cause thrombocytopenia, so monitoring platelet count, B, is critical to detect bleeding risk. Blood pressure, A, blood glucose, C, and respiratory rate, D, are not primary concerns with dasatinib. 70. A nurse is caring for a patient with a history of heparin-induced thrombocytopenia, HIT. Which anticoagulant is contraindicated? A. Argatrobin. B. Fondaparinux. C. Enoxaparin. D. Bivalirudin. Answer: C. Enoxaparin. Rationale: enoxaparin, C. A low molecular weight heparin is contraindicated in HIT due to cross-reactivity with heparin antibodies. Argatrobin, A. Fondaparinux, B. and bivalirudin, D. are safe alternatives for HIT patients. 71. A patient with sickle cell anemia is admitted with a fever. What is the nurse's priority action? A. Administer antipyretics. B. Obtain blood cultures. C. Restrict oral fluids. D. Apply a warm compress. Answer: B. Obtain blood cultures. Rationale: fever in sickle cell anemia suggests possible infection, a serious complication. Obtaining blood cultures, B. identifies the cause and guides treatment. Antipyretics, A. treat symptoms. Fluid restriction, C. is inappropriate. Warm compresses, D. are not indicated. 72. A nurse is teaching a patient with hemophilia about medication safety. Which instruction is most important? A. Avoid aspirin. B. Increase vitamin C intake. C. Take medications with meals. D. Limit fluid intake. Answer: A. Avoid aspirin. Rationale: aspirin, A. inhibits platelet function, increasing bleeding risk in hemophilia, so avoiding it is critical. Vitamin C, B. is not related to bleeding. Taking medications with meals, C. is not specific. Fluid restriction, D. is unnecessary. 73. A patient with multiple myeloma reports nausea and confusion. What should the nurse suspect? A. Hypercalcemia. B. Hypoglycemia. C. Hyponatremia. D. Hyperkalemia. Answer: A. Hypercalcemia. Rationale: nausea and confusion in multiple myeloma suggest hypercalcemia, A. due to bone destruction. Hypoglycemia, B. Hyponatremia, C. and hyperkalemia, D. are less likely without specific risk factors. 74. A nurse is caring for a patient with a history of blood transfusions. Which lab test monitors for transfusion-related complications? A. Serum ferritin. B. Blood urea nitrogen. C. Serum sodium. D. Fasting glucose. Answer: A. Serum ferritin. Rationale: serum ferritin, A. monitors iron overload, a complication of frequent transfusions. Blood urea nitrogen, B. Serum sodium, C. and fasting glucose, D. are not specific to transfusion complications. 75. A patient with thrombocytopenia reports gingival bleeding. What should the nurse recommend? A. Use a soft toothbrush. B. Brush vigorously. C. Avoid oral hygiene. D. Use a hard toothbrush. Answer: A. Use a soft toothbrush. Rationale: gingival bleeding in thrombocytopenia requires gentle oral care with a soft toothbrush, A. to prevent further bleeding. Vigorous brushing, B. or hard toothbrushes, D. worsen bleeding. Avoiding oral hygiene, C. increases infection risk. 76. A nurse is reviewing a patient's lab results showing a hemoglobin of 9G/DL. Which intervention is most appropriate? A. Encourage high-impact exercise. B. Prepare for blood transfusion. C. Restrict dietary iron. D. Administer diuretics. Answer: B. Prepare for blood transfusion. Rationale: a hemoglobin of 9G/DL indicates moderate to severe anemia, often requiring a blood transfusion, B. if symptomatic. High-impact exercise, A. is unsafe. Iron restriction, C. worsens anemia. Diuretics, D. are unrelated. 77. A patient with Hodgkin lymphoma is receiving radiation therapy. What should the nurse teach the patient? A. Avoid skincare products on the treatment area. B. Apply heat to the treatment site. C. Increase sun exposure. D. Use abrasive soaps on the skin. Answer: A. Avoid skin care products on the treatment area. Rationale: radiation therapy irritates the skin, so avoiding skin care products, A. on the treatment area prevents further irritation. Heat, B. and abrasive soaps, D. worsen skin damage. Sun exposure, C. increases burn risk. 78. A nurse is caring for a patient with a prolonged INR. Which food should the patient avoid? A. Spinach. B. Chicken. C. Rice. D. Apples. Answer: A. Spinach. Rationale: a prolonged INR suggests excessive anticoagulation, often from warfarin. Spinach, A, is high in vitamin K, which can reverse warfarin's effect, requiring dietary consistency. Chicken, B, rice, C, and apples, D, do not significantly affect INR. 79. A patient with sickle cell disease is prescribed hydroxyurea. What is the primary purpose of this medication? A. Reduce pain. B. Increase hemoglobin production. C. Prevent vaso-occlusive crises. D. Enhance immune function. Answer: C. Prevent vaso-occlusive crises. Rationale: hydroxyurea increases fetal hemoglobin, reducing sickle cell formation and preventing vaso-occlusive crises. C. It does not directly reduce pain. A. Increase hemoglobin. B. Or enhance immunity. D. 80. A nurse is assessing a patient with suspected anemia. Which physical finding supports this diagnosis? A. Pallor. B. Hypertension. C. Fever. D. Weight gain. Answer: A. Pallor. Rationale: pallor, A, is a classic sign of anemia due to reduced hemoglobin. Hypertension, B, fever, C, and weight gain, D, are not specific to anemia.